Hey everyone, I'm Kim Palmer. I have my bachelor's in psychology and a master's in counseling. I am a private practice therapist and I specialize in trauma and more like horrific trauma. I do human trafficking, incest, rape, the fun stuff. So, your turn. Thank you.
Hi, everyone. My name is Brooke Johnson. I got my undergraduate degree, bachelor's in psychology, and then I got my master's in social work. I'm currently working at a private practice as a trauma therapist, mostly working within personal injury, so a lot of car accidents and other like workman's comp type of cases.
Hello, I'm Zoe Garza. I did my bachelor's in family and human development and psychology at ASU, and I have my master's in applied behavioral analysis. I currently work for Allied Pediatric Therapy, which is a clinic that's in the Phoenix area, both West Valley and East Valley. And my focus right now is early intervention, working with kids on the spectrum.
Great. Hi, I'm Natalie Faber. And my undergraduate degree was from University of California at Santa Barbara. I double majored in psychology and women's studies. And then I did graduate degrees here at ASU. I got my Master's of Education in Counselor Education, and then my PhD in Counseling Psychology. And then I went back to the UC system, UC Davis, and did a internship and postdoctoral residency in psychology, and then came back here to do work. And I've done a number of different positions for ASU, but I actually work for the West Campus, campus's psychology department, teaching mostly online undergraduate and now mostly graduate psychology courses. And then I also have a private practice, also working with adults with trauma histories, and actually some overlap with some of you. I specialize in working with folks who have survived cultic abuse, coercively controlling group situations. And I also work for a nonprofit that focuses on helping survivors of cultic abuse. And I particularly help teach clinicians to work with that population. So I create continuing education courses for that nonprofit.
Thank you. Quite a variety here, which is fantastic. So the first question that I'd like you guys all to discuss is, what was your journey like from when you were sitting where these guys are sitting as an undergraduate to where you are now? And sort of talk a little bit about how you made those decisions when you were deciding on a grad program, or you're deciding on an internship or things like that, sort of what led to those decisions.
So when I was in grad school, I really was intrigued with how to process, how like the brain, like the science of how the brain does stuff. And so my actual path was just bachelor's here at ASU, master's, but I really went out of my way to get teaching assistant positions, research assistant positions. And I really tried to study I liked the abnormal psychology stuff. I found it fascinating, didn't scare me. And so I tended to read more of those books like in my off hours, so to speak. And so when I got out and about, I was able to do that. I did spend a year doing court-appointed work in Tempe. I don't know if they still have it, but they had a program where it was your first time arrest. You could get sentenced to therapy rather than go to jail. And you would think that if your choice is jail or therapy, you would choose therapy, but that is not how it works. And so I did not like that because it made therapy so punitive, you know? And so then I moved on to private practice.
So when I started undergrad, I actually did not have a major. I was exploratory. I had no clue what I wanted to do with my life. And I had taken a psychology class and I was like, whoa, I really love this. I love being able to understand a lot more about why people do what they do. And then still didn't really know what I wanted to do for work, but I took the abnormal psychology classes and I just fell in love with DSM and like everything mental health, behavioral health related. And then I kind of explored the field through working as a behavior tech for kiddos with autism. So helping them with like social and communication skills. I really, really enjoyed doing that work. And that kind of helped me decide I wanted to go the more clinical route. So talking with professors, I realized going the social work route was actually the better fit for me because I still didn't know 100% that's what I wanted to do for the rest of my life. So social work kind of lets me be in like private practice, clinical settings, but I also have the variety to go do pretty much anything else within a social work type of setting. So I worked at a community mental health center for my first year internship. I really liked that, but I didn't feel like I could get as effective work done just due to lack of resources. So that is how I ended up at private practice.
So started, undergrad, I think the biggest thing that helped me was really taking on exploring different careers during that time. Like my colleague said, looking at research opportunities, understanding if you even want to do research. Seeing your 30-year-old professor with gray hair is not always the most fun thing to see if you're thinking about going into research. So, which is a really common psychology pathway. So getting into research and then getting an internship to figure out if what I wanted to do was either clinical, and I wanted to work with kids. I knew I wanted to work with a younger population. So I started by being a behavior tech, which is how I got into my career now. But I also looked into clinical, being a school psychologist and overlapping and shadowing that job, just reaching out via email, asking and being interested, especially as a student. It let me know that I was more going to be doing some assessments, but not a lot of whole work with students. A lot of table work, a lot of writing reports, things like that. It's not that I don't do that now, but I wanted to be more active with my clients. So, did my undergrad. I took 1.5 years off just to work, build up some money to be able to afford my master's program. Did an online master's program part-time, worked full-time during that time, getting clinical hours. And then I took my licensing exam and board exam and am here now.
Let's see. I gotten interested in psychology actually in middle school. I read a book called Reviving Ophelia, Saving the Selves of Adolescent Girls, and it was very popular at the time back a few years ago when I was in middle school, and it actually really spoke to me as a little girl. And then so I kind of felt my way and wanted to do psychology, and then majored in it as an undergraduate, and just knew I needed to kind of do the best as that I could academically and get involved in research just to open up my options. But I really had no idea what I was getting into or really what the field of psychology was about at all. And I've just been kind of feeling my way since. And I would actually say that I didn't really know what I really, really was passionate about. I was really been more of a generalist psychologist for many years and was happy with that, but didn't really find my real passion until way after getting my PhD and my license and working in all sorts of different, settings. I just got a lot of exposure to all sorts of different populations, older and younger, and all, sorts of different settings with all sorts of different presenting problems. And doing, as a psychologist, you're doing the research aspect, you're doing the teaching aspect, you're doing the clinical aspect and consultation, and you're just getting lots of different experiences until you sort of stumble on what you're really interested in, which, for me, again, I didn't really discover that until after I'd already defended my dissertation, but none of it was a waste because you kind of build on the different experiences that you have. So that's, and I actually worked for some of my other jobs for ASU. I worked for ASU Counseling Services as a therapist, working with students like you with the personal problems that you have. And then I started an integrated behavioral health center over at Health Services, working with the primary care doctors, and all of that was wonderful experience too. And I like doing different things and staying, keeping things fresh and interesting. So, yeah.
Thank you. Great information. So the next question that I have is, can you talk about some of the most rewarding aspects of your job? Sort of what keeps you going back? What makes you excited to be there every day and keep doing what you're doing?
So a lot of people don't realize this, but when you go through something horrific that is, like, I'm so glad that you talked about ritualistic abuse, because we often don't think about these things as being common. But surprisingly, here in Arizona, it's a thing. Like, and we have people who like are trafficked out of their own home when mom and dad are at work. Like, these things happen. And so when I am able to work with someone and help them realize they're not alone. Oh, this is, now I wish it wasn't so normalized. I wish it wasn't so common. But when I help these people realize, oh, sweetie, you're not alone. This is what happens and this is what happened. And let me guess, you're thinking this and this and this. And just to hear them go, oh my gosh, I'm not crazy. Because I mean, I would bet very few of you have ever even met someone who has admitted that they've been through satanic ritual abuse. And yet, I bet every one of you knows someone, they start saying anything. And so when we help people, I think that's even a principle from Yalom, the group therapist. He talks about normalizing it. Again, not normalizing it to make it sound like, oh, it's totally normal, but normalizing it, that their feelings and what they're going through, they're not the only one. I think that it's the most rewarding thing because it's fascinating to me how just that one principle creates so much relief in people.
1000%. I agree with that so much. I love being able to really normalize things for people, to just say like, hey, like, you're not losing your marbles. Like, a lot of people really go through this. And I see the same thing that she's describing, that just like relief that can hit people's face. Like, there's just so much, I don't know, kind of power in a positive way that comes from being able to provide people with that kind of self-insight to see like, wow, I can understand what's going on in my own head that feels so bizarre. But also, the thing I've really kind of like is that it's not always so dark and twisty. Like, we hear trauma, that's kind of what we think. But there's a lot of uplifting in it, a lot of empowerment that comes through it. And it's kind of nice. I get to be almost like not a cheerleader, but I get to be cheering people on all day and be proud of people, which is really nice to be able to do.
I love that. Yeah, being proud of your clients, right? Being their support person or their cheerleader. I've worked with teens, young adults, and I've found myself in the space working with young kids, which also involves working with their caregivers, grandparents, cousins, mom and dad. And oftentimes we are the first people they call. They get diagnosed with autism. They get a long list of here's every service in the state that you're going to need. 40 hours of ABA, 3 hours of occupational therapy, 4 hours of physical therapy. The list goes on. It's incredibly overwhelming to get a diagnosis like that, especially for a 2.5-year-old, a 4-year-old, a teenager later on in their life struggling with middle school or high school. And so being able to bring them into a community of a bunch of kids where I work at a clinic and they can see and come in that their kid, again, is not alone. They have all these other amazing skills and really focusing on their strengths and not looking through a deficit lens, right? Our job a lot of times is to find the issues, right? What can we fix, right? Oh, what's the problems? And our assessments do that too. But really it's about, I think the most rewarding part is helping to reframe that to have it be more strength-based approach to what their kids can do, what they can do as parents realistically, and setting realistic expectations to be able to succeed and live the best quality of life.
Yeah, I would say ditto in terms of working with my therapy clients, especially those of folks who are coming in to help process their trauma and work through grief and relationships and mental health symptoms. But then in terms of the most rewarding part of teaching is really just engaging students in the learning process, making them realize how fun it can be to learn and making them feel a sense of academic self-efficacy, you know, that you actually realize you really can do this and that you're totally can be awesome at it. And then to help students sort of develop transferable skills, because a lot of people don't necessarily go into the field of psychology, but there's so much that you can apply. And I think being a psychologist in general, like one of my graduate professors said, you know, one of her parting words when we graduated our class was to position yourself for lifelong learning, which I think was really, really good. And I that's what I personally like the most about psychology, is that the science is always changing, whether you're talking about doing therapy or understanding people, you know, we're always getting better and realizing that we can do things better and heal more and understand more and live in a you know, hopefully one day a healthier, more functioning society. And just the idea that we make decisions based on information, you know, based on data, and that's ethical really to do. I think I really like that piece of it as well. So those are a lot of what really turns me on to this field.
Thank you. So for our next question, thinking about what you thought your job was going to be when you were, you know, preparing for it, deciding on grad school, deciding what you were going to, you know, do with your life, thinking about what you thought your job was going to be like and what it is like. Can you talk about sort of some of those differences? And in that, can you talk a little bit about what your day-to-day is like with clients or admin or whatever you guys have to do?
Okay, I thought I would love working with kids and families and couples, and I hate marriage counseling. It is two people fighting on my couch, and I hate it. And I was surprised because I have friends in the business who they love marriage counseling, and I'm like, you go, you do that. I did not think I would like what I like. I would have thought it would have given me bad dreams, but I'm surprised. And that's one thing I think for all of you guys who are going to school right now. There's so many things that I didn't realize I would enjoy. I did a year and a half working with autism. That's great. That was a million years ago now. That research doesn't even apply now because there's been so much research. And it's not something like I spent that year and a half because I was like, I can do this. And boy, was I wrong. And that's okay because there are other specialists who are really good at that. It is okay when you go out there that you right now try everything you can, get a flavor of everything, and it is just as important to find out that what you don't like as what you do like. So none of your time is wasted. And honestly, the biggest, most important thing I can tell anyone is try everything you can, volunteer for everything you can, because I love my job. My day to day, I go in my office, I have my own little office, and I love it. I have a couch, I have my own little comfy chair, and my clients come in one by one. I'm a cash only therapist. I set my own hours, and it's great. I buy a lot of Kleenex. We go through a lot of Kleenex in my office. But I have the most fascinating job ever. I will say one more thing, and I'm sorry this has taken a long time. When I was an undergrad at your age, I had someone tell me, and it may have been you, I don't know. Someone told me this: if you're going to go into this line of work, you have to be careful what you let in your head when you're in your off hours. So, like, because of what I do, I don't find it fun to watch scary movies. And my sweetheart loves movies, loves them. And if the movie's too intense for me, I will go, you watch this. I'm going to go out in the hall and shop on Amazon, okay? And it's great. But I know that I have to protect my brain for what I do because it really does affect your life, but I think in a good way.
There was a lot of good stuff in there. Sorry, I'm still thinking. Yeah, I guess with my job, it's a little weird that we're very specialized just working with personal injury. So again, like 90% of what I'm dealing with is car accidents and PTSD from there. part of why I went into this profession is because I didn't want to go into a job that felt monotonous, that felt like I was doing the same routine day in and day out. Part of the challenge with this job is working within a specialized population. It can feel kind of monotonous at times. So there's kind of this extra challenge of being extra mindful of, hey, I'm not going to imprint my ideas onto this person just because I've seen hundreds of other people with the same presenting problem. They might still be looking at it differently, but it's a thing to have to be conscious of, to not get stuck in that rut, but to still be like actively showing up for your patients in the right way. And in kind of the same fold, this work, they will warn you, it is draining. Like it does take its toll on you. So you have to find your balance in the people that will fill you up, and you need that social time. You can't just be talking with your patients all day. You can't just be doing the work, because you need your own thing that'll fill it back up. So have your community, have your people, get out there. I love what she said about explore, like try things. It's probably one of the best things. You learn so much from anything you'll do. You learn what you don't like. If it's a really bad internship or a really bad job, you'll learn, cool, I'm never going to do that stuff again. You'll learn, you will. Or you'll learn, oh, I really love that part of it. So the open-mindedness, the willingness to take nuance with everything that you're doing, that's probably one of the best things that I find with this job. Like, don't get stuck pigeonholed in some way.
It was hard to kind of answer that question, Dawn, of what did I think my job was going to be like? And, in order to get to where I am now, I did have to be a technician with supervisors and, what I wanted to be, right? But I only saw them for the direct overlap with my kiddos, right? I don't think I realized how much work goes into the current job that I have, all the administrative tasks that add up, calling insurance companies, doing peer reviews because the insurance company doesn't want to provide services for your client, sending emails to parents back and forth, phone calls of, whether it's grateful news or some barriers, right? So it was really hard to know, because when I started in this field, it was relatively very new. Not that it's not a new field, but it was something that still is growing. But in terms of my day-to-day now, it's hard to describe because my day looks very different every day, which I love. So there is, I think, where you can go for that strength approach of, if you love routine and having a routine, and not that I don't have one, but it looks very different. It could be doing, I show up to work, I show up to the clinic. I schedule all my clients. I have about 14 right now. I also share that with a supervisee, so I support them in their development and coach them through how to be a BCBA. But it could start with a parent meeting, right? Whether that's virtual or going into a home, going to a Walmart, going to a trampoline park. It could be an assessment, right? I'm taking in a new client. It could be just supervision, me looking at how treatment is going, how the technician is doing, how the client is making progress, or what barriers they're experiencing. So it's made up of a lot of things. If I could be here all day talking about all the different things I do every day, but in general, I show up to work. I have a schedule. I have something to do, but it's all, for the clients. It's all in support of the clients.
Let's see. I think the first thing I'd say about what surprised me was more like what surprised me about graduate school and the process of becoming a psychologist. I think a lot of graduate students, it's sort of a shock to the system because you're used to sort of doing really well academically. And all of a sudden, if you're pursuing like a more of a clinical path, there's really a whole nother skill set that you need to sort of master. So in terms of just the vulnerability that it takes to become a good clinician, because really it is sort of you, and you're bringing a lot of your own stuff into the room. And that's what we know from the common factors research. It's you as a person and what triggers you, or, how you are in the room, and your experiences really are brought to bear on how effective the therapy is. And so a lot of becoming some kind of a clinical or counseling psychologist or some other type of clinician in the field of mental health, it's a lot of self-growth and reflection and really hard. We call it another blank growth experience and whatever we have to go through, some kind of a growth experience to meet the demands of becoming a good clinician. So being a perfectionist is not what makes you a good therapist. And that can be kind of come as a shock. So that would be one thing that I would say. Another thing I would say in terms of the transition from graduate school to career, I think for me, doing clinical work full time is not really sustainable for my mental health. I needed more of like a part-time, be able to focus and not get burnt out, and deciding to have teaching be my full-time job, I think was something that maybe surprised me. And I think with all the technology and all the changes, and teaching online, like that is something I never, ever expected that I would be doing and actually really love. Turns out I actually really love going to coffee shops and working on modules and doing all those nerdy things, because it reminded me of what I felt really good at as an undergraduate, which was going to coffee shops and writing things and looking things up and reading articles and synthesizing information, like writing essays and creating presentations. I actually really like doing that. So yeah, those would be some things. And didn't you want us to talk about our day-to-day? Yeah, I get to go to a lot of coffee shops. That's one thing that I like about teaching online courses. I also teach a little bit of in person, but very, very rarely. And that's really fun too. And then, yeah, I have a private practice in Old Town Scottsdale. So I have an office, and, then I'll kind of pop in and out and see clients here or there. Sometimes there'll be telehealth, go back and forth, volunteer at my daughter's school, so I'm kind of like all over the place, and go to faculty meetings over at the West Campus, or, fly to different conferences, or, I'm on the board of a nonprofit that I told you about. So I had a board meeting. So it's different every day. And I really like that. I like that I get to kind of, for the most part, make my own schedule. That's very satisfying to me, but it's changed according to what, when I was a staff psychologist at ASU, it was every day, 8 to 5, doing therapy or doing crisis management with students, or sometimes doing after hours crisis calls. So that was more, being in the office with the door shut, working one-on-one all day long, which was very, very rewarding as well. So it depends a lot on not only what field you go into, but also like what setting you're going to work with and what type of population you're going to work with.